order. Hope everyone enjoyed their long weekend and time with their family. Just like to remind all the members of their obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare at that time. We have report LTCR-CM-05-21, the COVID update. Can I have a mover to get that on the floor, please? Moved by Christine and seconded by Brian. Jennifer, are you taking us through this report?
I am. Thank you, Mr. Chair.
We'll turn it over to you.
Thank you. And I wondered if I might just make an introduction to a new team member before I go into the report. Is that okay with you?
Absolutely.
Okay, great. Thanks. So I'd like to introduce Dana Leach. She is there on your screen somewhere. There she is. So Dana will be taking on the new role of long-term care clinical specialist for the 3 care communities. She'll be leading the clinical programs and working collaboratively with our interdisciplinary teams to coordinate best practice of care that promotes a positive, color it your way environment for our residents and our staff. Dana is a registered nurse with over 29 years experience working in healthcare. She has a sound knowledge and experience of Ministry of Health, College of Nurses, public health standards, policies, and procedures. Dana's vision of excellence for healthcare has led her to a teaching degree and healthcare management diploma. Over the last 17 years, Dana has worked at the Grey Bruce Public Health as the public health manager, who has worked closely with our area's 19 long-term care homes and helped lead the fight against COVID-19 pandemic. And we're very pleased to have her join our long-term care team. So welcome, Dana.
Thank you very much, Jen.
Welcome, Dana, on behalf of the Long-Term Care Committee of Management. It's nice to have you aboard. We look forward to working with you.
Great, thank you. And now I'll move into the COVID update. So we are almost a year into the COVID pandemic, and our communities have stayed strong and maintain our vigilance to ensure that our residents, caregivers, and staff are well prepared in the case of an outbreak. Infection prevention and control measures continue to be in place, and we've implemented additional resources. An IPAC lead has been assigned at each location and is responsible for supporting IPAC audits, education, in addition to our IPAC measures, we are also recruiting surveillance support staff, and we'll talk a little bit about that a little bit later, to assist with the rollout of the rapid antigen testing. The Director of Care and Associate Director of Care at each care community, along with the IPAC lead, will also be completing essentials in infection prevention and control through IPAC Canada, so some specialized IPAC training. And all staff will be completing the Public Health's IPAC core competency modules through our e-learning profile platform. And we will continue to manage our PPE supply. So a few updates since the last time we met. Vaccination. So vaccine continues to be a hot topic, and the data shifts and changes as the supply changes. But public health has provided us information related to the COVID-19 vaccine preparation and a phased-in approach. We have been using this education to prepare and educate our residents, families, and our staff, and they have been actively filling out consents to be prepared for when the vaccine arrives. The rollout of vaccine has been a phased-out approach, and the doses received were divided amongst the 19 long-term care homes. On January 19th and 20th, Stephanie Okafra and Andrea Jackson, our pharmacists from CareRx Pharmacy, joined our family and virtual staff meetings and provided an educational overview and Q&A to the COVID vaccine. This education was really well received, and I think helped support the uptake in staff and families and residents signing their consents. On January 25th, Moderna vaccine arrived for Rockwood Terrace residents. It arrived at 2 p.m. and the vaccination clinic started immediately. 84 residents were vaccinated. Lee Manor was notified about a small shipment on the 20 and 22 residents on the first floor received vaccine on January 28th. Grey Gables residents received their vaccine on Saturday, February 6th, and 67 residents were vaccinated. Lee Manor received their vaccine on February 6th, Sunday, February 7th, and the remaining 123 residents were vaccinated. So as of last weekend, all of our residents that are able to take the vaccine have been vaccinated their first dose. So that is really, really good news. There was a memo that came out on the weekend with a little bit more information about vaccine arriving and reiterating the priority guidelines from the province. And so our staff, long-term care staff, and designated care partners are next on the list to receive vaccine as it arrives. And we're anticipating some this week. So that's also really good news. Testing, lots going on in the world of testing. Our care communities continue to test all staff and our designated care partners, which are our essential family members, weekly. And the testing is available throughout the week in order to accommodate schedules. Through surveillance testing, both Lee Manor and Rockwood Terrace, and as recently as this past weekend, Grey Gables has received an indeterminate COVID-19 result. So when that happens, we work in collaboration with public health. An outbreak is not declared, but we do implement additional infection prevention and control measures. In some circumstances, tray service is offered to specific home areas. The individuals were all asymptomatic and directed to self-isolate. They are retested, and within a few days, we received confirmation that all indeterminate cases were confirmed to be negative. So it does happen with the volume of testing that we're doing. There is bound to be indeterminate results from time to time. Rapid antigen testing was introduced in January, and our long-term care communities have received the rapid antigen testing kits, which have proven to be very beneficial at all three of our homes in assisting with our surveillance testing process. It was announced by the province on January 27th that all long-term care homes are required to transition to rapid antigen testing for staff and designated care partner surveillance. Our region is required to be operational by February 22nd. And since in the time that this was written, and you notice that you got this kind of at the end of the week last week, but since then, there has been an update from the province that has shifted the date slightly. We are to have our designated care partners who will be rapid tested every time they present at the home. That needs to be operational by February 22nd. The staff and volunteer testing for rapid testing needs to be started by February 28th, and the entire rapid testing program needs to be fully operational by March 15th. So we are working our way through operationalizing that. It is a significant change. Currently our staff are being tested a nasopharyngeal swab once a week. They will now need to be tested 3 times a week. And our designated care partners, who are currently tested once a week, will have to be tested every time they present at the home. So additional human resources are necessary for us to be successful in this transition. Internal and external recruitment efforts are underway. Additionally, each home must set up an appropriate space to conduct rapid antigen testing. The space must be accessible, large enough to allow for safe distancing of individuals and allow space for individuals waiting for the results and not impacting resident home area. The teams are being extremely creative to find an appropriate space that meets this specific criteria and will not negatively impact the residents. The Ministry of Long-Term Care also notified all long-term care homes, and there is a memo linked below, that mandatory third-party oversight of active screening is now required at the screening stations. Funding has been provided to support this. Current service provider Fairmount Security will take on this role at all 3 locations to ensure full compliance. And since the writing of this, there has been an update that outside of the hours of testing or when we would lock the doors and not really be having people coming and going, we are not required to have the third party oversight. So say from 11 p.m. to 6 in the morning. So I'm just seeking clarification from the province to make sure that that is in fact accurate. And if that's the case, then we'll scale back our current request of Fairmont. The visiting in the DCP program. On January 15th, we received clarification regarding visiting. So visiting has changed a lot over the week to week and month to month. General visits were restricted on December 26th, and due to the lockdown measures in place, window visits were also restricted, and we quickly notified families of the change. Our Color It Connect virtual visit program continues, and each location has increased the number of virtual visits to ensure family and friends have the opportunity to connect with their loved ones. On January 22nd, we received additional clarification that long-term care homes could reintroduce window visits if they could be accommodated. Our homes reviewed the risks and agreed that due to the new variant and in order to support lockdown measures, our window visits would remain suspended. And we communicated that with families and had no concerns raised from family members or residents. Our designated care partner program continues to grow, and we currently have 318 active designated care partners safely supporting their loved ones living in our long-term care homes. The only change to our DCP program during the stay-at-home orders was that only one DCP may visit at a time. Normally it would be two. And so right now we're sorting out, moving into level yellow, what does that change? And so we're sorting through those details. We continue to meet with the Evaluation Collaborative Group, along with the Canadian Foundation for Healthcare Improvement, Long-Term Care Plus, Acting on Pandemic Learning Together program. In early January, we met with researcher James Conklin from Long-Term Care Plus, and he provided an overview of the research project that Grey Gables is participating in. It was noted that as we work through the process, the committee will increase to include additional members, specifically residents, families, and designated care partners, and frontline staff members. To collect additional data, it is anticipated that an additional survey will be released at the end of February to the participating home, which is Grey Gables, again in May and September. And updates of this work will be provided through the process. On January 26th, Jessie Chuckley from the Canadian Foundation of Healthcare Improvement Essential Together program interviewed me about our Grey County how we developed and rolled out the Designated Care Partner program. During the interview, we talked about our successes, our milestones, and some learning moments. And it's really exciting that this program is being recognized and highlighted for the positive impact it has had for our residents and our care communities. Staffing. Due to the lockdown measures, there has been an increase in leaves due to daycare or school restrictions. Recruitment of staff continues, and educational opportunities are being introduced to the emergency support workers and care support assistants to support their career in healthcare. Funding. Funds continue to be received from the Ministry of Long-Term Care for each community to support the implementation of the third-party oversight for screening. The county has also received additional COVID containment and prevention funding up to December 20th. As well, additional COVID containment and prevention funding has been received that will fully cover all of the COVID costs incurred in the period of April to June 2020. Each of the care communities have also received IPAC training and personal funding that will support the cost of the IPAC lead in each home, as well as that IPAC specialized training that I spoke of at the beginning of the report. Partnerships. Work continues with partnerships at both regional and local levels. The Grey Bruce Long-Term Care Committee Public Health and Partners meeting continues every 2 weeks. Regular meetings continue with the Southwest Regional Pandemic Planning, Wave 2, and the Grey Bruce Health Integrated Health Coalition. And these groups play a critical role in ongoing pandemic planning and preparation. With new variant concerns, our 3 care communities have been in close contact with public health and our hospital partners to coordinate third-party IPAC risk assessments. These assessments have helped us to identify any areas that require improvement or modification. Educational sessions are currently being organized to help support hospital staff who have volunteered to support long-term care homes if they get into crisis. Both strategies will support positive relationships, allowing for a more nimble and prepared staff crisis response. Going forward, work continues on outbreak strategies, implementing new COVID educational resources and toolkits, managing and monitoring our PPE supplies. We continue to be thankful for the support from the CAO, senior management team, and staff in all departments. And we recognize that we are in this together as we color it for our residents, families, staff, and communities. So I know it feels like we only met a month ago, and that's a long report, but that is all the things that have been happening since we last met. And I don't anticipate it to slow down in the coming weeks. There is a light at the end of the tunnel with vaccine, and we're getting to be pretty good at infection prevention and control. And but on the other hand, everyone, our staff, all of us are getting a little bit tired. And so it's important that we go back to the basics and talk about the basics of IPAC and do those refresher trainings and check in. So I have some concerns about the variant on our doorstep, and I think it's really important that we're as prepared as we can be. So happy to answer any questions.
All right, thanks very much, Jennifer. Certainly a lot of information, and congratulations on the accolades around the designated care program. Good work to the entire team. It's nice to have that recognition. Okay, questions from committee members. Councillor Klumpus, go ahead.
Thank you, Mr. Chair, and thank you, Jennifer, and all the staff. My goodness, when I read this and now here going over it again this morning, it's quite an incredible report. We're all concerned about overwork, overload, concerned about staff morale, concerned about our particularly our staff health and managing all of the work that is being expected of you as this progresses. So kudos to you for your bright and smiley face all the time and the encouragement that you provide to your staff. I'm sure it's recognized and very welcome, but we're all concerned about you, first of all. My question was about the mandatory rapid testing program that's going in, and the comments that I've been listening to over CBC as well, that this is going to be a huge drain on staff resources in terms of the frequency and the necessity to test, well, almost daily as any visitor comes in. How do you go about recruiting at a time and a place where staffing issues really are in the healthcare field are at staffing as a premium? How is this going for you, and what are you doing that is that you're able to increase the staffing level to accommodate these provincial mandates?
Yeah, thank you, and through you, Mr. Chair. Thanks for your comments, Barb, and it's all Mayor Klumpus, and it's always I always take the opportunity to take the comments back from these meetings and share them with the teams to share with their teams. And that support is really appreciated and really helps give us a boost. In terms of staffing, we are being as outside the box creative as you can get. So for some of our testing, I should give a shout out and great thanks to the paramedic services who have helped support the current testing at Rockwood Terrace. And so we really appreciate their support. And they have mentioned that they could help us out while we kind of transition and sort out our what we might do to be sustainable on our own. In the meantime, we are posting internally and also externally. And the province expanded the scope of people that are able to support this rapid testing. And so with some of Dena's contacts and past experience, we are reaching out to dental hygienists who may or may not be working full-time. If they're part-time, we will be creative to be able to support them. We need to double check and make sure they can work at a dentist office and in a long-term care home. But that's one thing that we're doing, is looking outside of the traditional I guess, RPN. There was a time where there were lots of RPNs looking for work and needing some hours, and that seems to have changed. There aren't as many RPNs available. So we're looking at that. We're looking at, is there ways of being flexible internally and having people do their regular shift, and they're looking for just a couple of days extra a week so they could do swabbing. So we're trying to be creative, try to support people in what works for them, and bringing in some new different skills like dental hygienists. And paramedics is another area that we're targeting. It can be a very competitive market for paramedics getting onto the I don't know if it's called a force, but to the team that the employer that they're looking for. And so if there are paramedics that are looking for work, we may be able to offer them something as well.
Good luck with that. Thank you.
Thanks.
Thanks, Jennifer. Councillor O'Leary, go ahead.
Thank you, Mr. Chair, and thanks, Jennifer, for a great report. Just wondered if you could talk about the January 19th virtual family meeting. How is that done? Is that done one home at a time, one family at a time, or and what's the, I don't need to know the numbers, but what is the participation look like?
Sure, thanks,
Go ahead,
Councillor O'Leary. Thanks, Mr. Chair. So the family virtual meetings, we've been doing them since, I want to say, March, because I think I did my first one in the county office. So I didn't move offices until April. So those have been going about every month or 6 weeks. Rob Hatton is an excellent co-host and support. So Rob and I chair those meetings. I usually give it's a Zoom meeting, and so we send the information out ahead of time via the subscription MailChimp newsletter. I think our most attendance was around 100. Our least was around 40, and it averages 50, 60 attendance, and it's for all 3 homes, so families from all 3 homes. I give an update similar to, in fact, the meeting that we have a virtual call tonight, and I have not yet written my script, but I will use the update that I gave today in this report as the framework for the update for the families. And then we do a Q&A, and so they ask their questions in the chat box, and Rob reads the questions, and I do my best to answer. And my team is always on standby, and we use the phone a friend feature. So if someone asks a question that I don't know, within a couple of minutes, my phone lights up, and one of my team members has texted me the answer, and or we follow up with a newsletter after, just with any questions that I didn't know the answer to. And these meetings have been really, really, really helpful in us making sure we're meeting everybody's needs. So in the early days of isolation and significant visitor restrictions, we got a lot of feedback about what really was important to family members, and they wanted to be able to come in and safely hug their resident. And so we worked with public health, and we found a way to be able to make that happen. So I have found them very helpful in making sure that we're not just keeping people safe, but we're also listening to what's important to them and balancing that. And Rob just sent me a message that they're recorded and they're posted to the Grey County page, and they are viewed on average 150 times. I can't believe that. Oh my goodness. Anyway, so I find them to be an excellent communication tool, and I get as much out of them as I've heard people get from them. So that's good.
Wow, that's fantastic. Thanks very much.
Well, looking at the screen, Jennifer, you've got a lot of competent friends that you can call. Are there other questions? Warden Hicks, go ahead.
Thank you, Mr. Chair. Jennifer, good report as well. I'm interested in the January 25th, when we received notice that we had the vaccines for Rockwood. So you say in the report that 84 people were vaccinated that day. Can you walk me through that? I'd just love to know how that happened. So did they arrive? Like, when did they arrive? How does that work in the home? How do they get around to their residents? Or are the residents going to central place, and how long did it take? Just flush that out a bit for me.
Go ahead,
Sure.
Jennifer.
Thank you. And I'm going to look at Karen and see if she minds if I put her on the spot, because I wasn't actually there. I just get to tell the good stories. But Karen was there, and if she doesn't mind me putting her on the spot, I think that she would do a great job walking us through that.
Thanks, Jen, and through you, Mr. Chair. It was quite an exciting time. I received the call on a Sunday morning that we were going to get vaccines on the Monday. So very short turnaround time, but we were prepared for that. They had told us all along that that's probably how it would be. 2 nurses from public health arrived at the home around 2 o'clock on the Monday. They drew all the vaccine into the needles, but the needles were actually given by our own staff. So the DOC and ADOC had a traveling cart that they went around the home and actually administered the vaccines. We had someone that went with them to help control the paperwork because there's a lot of recording. And the folks from public health actually entered the information from the paper into their system. And I just forget what their system's called right now, but they have to record all this on an online system. The vaccines were all completed by about 4 o'clock. They did have a few extras because we had one resident in the hospital, for example, 4 that couldn't receive it for medical reasons and 4 that refused. And they had brought 100. So we were able to get some staff vaccinated as well. But again, that was a last minute round them up, whoever can come kind of thing. But all in all, very exciting, very quick, in and out in an afternoon, and in a few short hours, actually.
So, Mr. Chair, two staff from public health, and how many from Rockwood?
3.
3. Okay, and 2 hours.
Yes.
Thank you.
Okay. Other questions? Councillor Robinson, go ahead.
Thank you, and through you, Mr. Chair, good morning to everybody. And as usual, Jennifer, an outstanding report, and congratulations to both you and your staff for just working through the pandemic the best possible way you can, in most professional way with you and your staff. My question is really a follow-up to Warden Hicks. I'm wondering what the process is for an individual who was not able to have a vaccine because of being ill, or if somebody potentially is allergic to the vaccine, or chooses not to take a vaccine. What strategies are in place? Thank you.
Okay, thank
Thanks.
you,
Go ahead, Jennifer.
Councillor Robinson. So for a resident and presumably a staff or designated care partner who aren't able to get the vaccine, we have raised that concern with public health and are working together with them. They have to sort out the rollout of vaccine in making sure that none of it is wasted, and that there is some held back for second doses and still be moving through their various phases. And so it's really complex, but they have that noted as something that is important to us, that if a resident comes back from hospital, how might that work to say they need to have the vaccine because they missed it at the clinic. And then we would also include new residents, right? So we're always moving people in to the home, and they won't have had their vaccine potentially either. It's a short-term problem because eventually when we have enough vaccine, we'll just be able to order it, put it in our own fridge, hopefully, and carry on. But so that is noted with public health, and it's something that they're building into their process. For people who choose not to have the vaccine or are allergic, I can't really speak to the allergic piece because I don't have the clinical background on that. But for people that choose not to, we provide education and we'll do a check-in. We have our pharmacists and our clinical staff available to support them if they have any questions. not necessarily, not to sway them, but just to make sure that they have all the information. And then if they still decide not to, we honor that decision.
Thank you very much.
Any other questions? Jennifer, I have a question just in regards to, you mentioned earlier about light at the end of the tunnel with all the vaccinations. What do you see that light being? Because, here we are, we're increasing all of the testing. We've got the vaccinations. I know there's still more people to be vaccinated in our long-term care settings, but, we're moving along the right path, but they seem to be increasing, testing and third-party, oversight. So can you just kind of help me out with, where we see ourselves, a few months from now?
Mr. Chair, I can't, but I do like to live in a place of hope and rainbows and unicorns. So I think it's important to be hopeful, and I don't know what it'll look like, but having everyone with 2 doses of vaccine will look better than it does today, where we still have staff not vaccinated with their first shot and a variant that we're still learning about. So I think we'll still be seeing a lot of the measures we have in place with maybe a little less of the angst.
Good. Okay. Thank you. All right. Councillor Burley, go ahead.
Thank you, Mr. Chair. Jennifer, not to be burst your candy canes or anything, but is there any record of anyone having the vaccine that have still encountered the virus?
Through you, Mr. Chair, I'm not sure, and I don't have research at my fingertips into that, and I don't know, Dana, I'm kind of putting you on the spot. If you have any, and if you don't, we can look into it and get back to Mayor Burley.
Certainly.
Go ahead, Deb.
Yeah. Yes, thank you. There has been evidence of those who've been vaccinated that have indeed tested positive. There's a couple of variables they're taking a look at. And part of that is timing of the vaccine. As you know, the incubation period can be up to 14 days. And they may be swabbed prior to getting their vaccine, but the timing. So yes, indeed, they have found some in the southern area, as well as across the province and across the Canada that has taken place. But so that's why, we continue to maintain those IPAC practices until such time as we're in a place where we're not testing as frequently. But yes, there has been cases. And we do know that the sensitivity, specificity, and certainly the vaccine effectiveness can be up to 95. And there are a number of variables. Again, how people take the vaccine, how they build their own antibodies. There's the host, certainly the individual can be part of those variables as well. So it is possible for sure.
Okay, thank you. Anything else? Okay, well, we'll call the question. All in favor of receiving this report? That is carried. Thanks again, Jennifer, to you and your team. I know it's been a long 11 months, but hopefully we're getting there. Okay, we now have a closed meeting matter. Could I have a mover? Sorry, so we have the Committee of Management now goes into closed session pursuant to section 239 sub 2 of the Municipal Act as amended to discuss personal matters about an identifiable individual, including municipal or local board employees, and labor relations or employee negotiations. Can I have a mover for that, please? Moved by Dwight, seconded by Barb. Who is remaining with us? Kim?
I believe that Jennifer and her team and myself are all remaining, correct? Yes, I don't think it is.
So I'll look to Heather to let us know when everyone has left that needs to leave.
Thank you, Mr. Chair. You will need to vote on the motion to go into closed.
Sorry, thank you. All in favor of going into closed? That confirm that while in closed, we only discuss the items in regards to personal matters about an identifiable individual and labor relations and employee negotiations. Okay, we have a redevelopment update.
Sorry, Mr. Chair, just
Yep.
before you continue, can Rob confirm that we're back on the live stream?
Absolutely. Rob, are you able to confirm we're live again?
Yes, we are back live now, Mr. Chair.
All right, thank you, Rob. All right, Kim, you're smiling, so I imagine you want to take this redevelopment update. Go ahead.
I will, Mr. Chair. Thanks so much. So just to advise the committee that we did have a kickoff meeting on the Grey Gables redevelopment project with our provincial project manager, as well as someone from the licensing department at the Ministry of Long-Term Care. That was on February the 2nd. We reviewed the status of the project, just catching everybody up because it's been a little while since we've spoken to one another. They let us know that they need to undertake the licensing review process similar to what was done for Rockwood Terrace in the summertime. So we'll get some more information about that, but you may see something in the public eye with regard to that question when the time comes. We reviewed the county's intent to work with our consultants with regard to the potential for redevelopment in the existing Grey Gables facility, just laying out the timelines for them that we anticipated. So what will happen next once that work is complete and the appropriate committees have had a chance to think through the next steps and the direction that they want to take. It'll be at that point then that we'll be looking at a development agreement with the province for the Grey Gables project. And the last thing I wanted to just show you, one of the things that the province was looking to have was a communications plan for the project. We did one of these for the Rockwood project as well, but if I can I'll just share my screen quickly here just to give you a sense of what this looks like. And here we go. Okay, now, what do you see on your screen? Do you see a communication plan or
we
a
have
map?
a communication plan, a picture of Grey Gables, and then the
Perfect. Okay,
goals.
that's what I wanted you to see. That's excellent. So this communication plan is really for the province's awareness, and it helps them to work in alignment with us when we think about how we want to speak about this project. What are the key messages? Where and what and when do we want to communicate? So it outlines some goals here to maximize the awareness of the redevelopment of Grey Gables and share the vision for the future of a campus of care as it's developed, to help people understand the impact of redevelopment, encourage the public and staff to participate in the redevelopment process as those opportunities arise, and to keep Grey Gables stakeholders. So that includes the people who are living there right now and their families, our volunteers and staff, as well as the public, just informed about how the progress of the planning for that new build there is working. And as I said, they're very similar to what we're doing with Rockwood Terrace. So the document lists the audiences, both primary and secondary, and then talks about key messages for each. And there's a lot of carryover from one group to the other. I'll draw the committee's attention to the fact that we do set up a redevelopment mailbox. So if people have questions for us, that they can email them to us, as well as give us a call if they have questions. But we, outline here what the intent is, just some really factual information that we want to make sure people are aware of. The redevelopment target completion date of 2025. And then moving on from there. So it's a very high level document, but the province is asking that we provide this back to them. And so if anybody has any questions with this, I'd be happy to answer them, or any suggestions, but otherwise we'll be sending that into the province this week.
Thanks, Kim. Can you forward that to the committee members also?
Absolutely, I can. Yep,
Thank
I
you.
will do that and have a chance to have a look. And happy to have your input. So thanks.
Any questions from Kim's update? There we go. Thanks. Barb, did you have your hand up? No. Okay. All right. Thanks for that update, Kim. Behavioral support transition, the BSTU update. Who's taking that?
That's also myself. Through you,
Go
Mr.
ahead.
Through you, Mr. Chair. After our last meeting, where you had provided support to Jennifer and I to continue to try and negotiate with the province, we did have a couple of follow-up meetings with the representatives from the Southwest LHIN. Unfortunately, we were not able to come to an agreement on extending the length of the project, the pilot period, or rolling over any of the resources into the future years. So given those circumstances, we weren't in a position to be able to continue on with that project. It's unfortunate, but given where we are in the pandemic and the significant amount of work that it would be to get the BSTU set up, it just didn't make sense to do that for a year. And so we want to work with the province, but we want to be able to work with them in partnership. And the project plan for the BSTU was really to try and demonstrate what a center of excellence for this work could look like in a rural context. And a year just wasn't going to be enough time to be able to do justice to that goal. So there we are, and hopefully something will change, and we'll hear more in the future. They'll be able to revisit it, but at this time, the staff there just weren't able to work with us as we needed them to this time.
Well, that's unfortunate, Kim. Is there anything politically that should be done? I mean, I think you've certainly outlined in previous meetings the importance of a behavioral support unit as a a regional facility. Do we just let this die, or should we take this any further at a political level and try to get to the point that we want to be? Any recommendations?
I think there's good awareness on that front. I did keep people up to date along the way about where we were, and my hope is that like we're right at the end of a fiscal year, right? The provincial fiscal year ends on March 31st. I'm hopeful as we get into a new fiscal year that there may be some flex in the provincial budget or new thinking going forward. The further we get into resolving the pandemic, the easier it will be for everyone to take on a new project and really run with it. So maybe the stars will align and the province will find some further budget flexibility in the future, and our own staff will have a little bit more capacity as well.
Okay. Well, thanks for that update, and certainly I'm glad that you're not taking us down a path that we weren't ready or prepared for. So
yeah.
Any questions of the update from any members of the committee? Not seeing anything. All right, our next meeting date is scheduled for March 9th. So if there isn't any other questions, I'll ask for a mover to adjourn. I think I may have frozen.
I see Councillor Burley and O'Leary.
Okay, thank you. All in favor? Yeah, I've got a number of frozen screens, so I will say that we are adjourned. Thanks, everyone.